Welcome back to our channel. Today we're diving into an interesting topic: what your hands can reveal about your health. From circulation problems to signs of nutritional deficiencies, your hands can offer subtle clues that you might not want to ignore. So, if you're ready to learn more about how to read the signs your hands are giving you, stick around. We're going to explore 7 things your hands might be trying to tell you about your health. Ever get those icy fingers even when it's not that cold out? You're not alone. One possible culprit is poor circulation. When your blood isn't flowing well, it can be harder for your body to maintain an even temperature, especially in your extremities. Stress can also be a major factor in cold hands. When you're stressed, your body diverts blood flow to your vital organs, leaving your hands and feet out in the cold. If you're concerned, it's always a good idea to talk to your doctor to rule out any underlying medical conditions. Shaky hands can be a bit unnerving, right? It's like your body has a mind of its own. But don't worry, it's actually a pretty common issue. One of the most frequent causes is simply anxiety. Think about a time you were nervous, maybe before a big presentation or a first date. Your heart races, your palms sweat, and your hands might have started to tremble. However, if you notice your hands shaking more often, even when you're not particularly anxious, it could be a sign of an underlying medical condition. One possibility is something called an essential tremor, a neurological disorder that causes involuntary shaking. If you're concerned about hand tremors, the best thing to do is consult with a medical professional. Our hands can actually give us clues about our liver health. It might sound strange, but it's true. One thing to look out for is redness in the palms, particularly the thenar eminence, the fleshy part at the base of your thumb. In some cases, it can be a sign of liver disease, specifically a condition called palmar erythema. If you notice this symptom along with other things like fatigue, jaundice, or abdominal pain, it's definitely worth getting checked out by a doctor. Early detection is key when it comes to liver disease, so paying attention to these subtle signs your body gives you can make a big difference. Let's talk about our nails, specifically a condition called clubbing. Essentially, clubbing is when your fingertips enlarge and the nail curves over the rounded fingertip. It might seem like a small thing, but clubbing can actually be a sign of something more serious happening beneath the surface, often related to your lungs or heart. Conditions like lung cancer, cystic fibrosis, and even heart defects can sometimes manifest with clubbed nails. If you notice your nails have changed shape, it's crucial to talk to your doctor to get a proper diagnosis and discuss any potential underlying conditions. We all want healthy, strong nails, right? But sometimes our nails can change color, and one of the most common changes is yellowing. One of the most frequent culprits is a fungal infection, especially if you're prone to getting your hands wet or wear artificial nails frequently. However, yellow nails can also be a sign of something more serious, like diabetes. People with diabetes often have high blood sugar levels, which can damage blood vessels and nerves, including those in your extremities. Other potential causes of yellow nails include thyroid problems, vitamin deficiencies, and even certain medications. If you notice your nails have turned yellow, it's always best to consult with a doctor to determine the underlying cause and get the appropriate treatment. Have you ever noticed your fingertips turning blue or white, especially in cold weather? It might seem strange, but it could be a sign of a condition called Raynaud's phenomenon. Raynaud's happens when the small blood vessels in your extremities, like your fingers and toes, constrict temporarily. This constriction reduces blood flow, causing your fingers to turn white or blue and feel numb or tingly. While for many people, Raynaud's is a minor nuisance, in some cases, it can be a sign of an underlying medical condition, like an autoimmune disease or a problem with your thyroid. Talk to your doctor if you experience frequent or severe episodes of blue or white fingertips. Let's face it, swollen fingers are annoying and sometimes even painful. One of the most common culprits is arthritis, which is inflammation of the joints. Another possibility is fluid retention, also known as edema. This happens when your body retains excess fluid, which can accumulate in your extremities, including your fingers. In some cases, swollen fingers can also be a sign of more serious conditions like kidney disease or heart failure. These conditions can disrupt the body's fluid balance, leading to swelling in different parts of the body, including the hands and feet. So there you have it, 7 things your hands might be trying to tell you about your health. Remember, our bodies have amazing ways of communicating with us, and sometimes those messages come through in the most unexpected places, like our hands. Thanks for watching. If you found this video helpful, don't forget to like, subscribe, and hit the bell icon for more health tips. See you next time.